Thank you, Madam Chairman. And I've got a question for Dr. Perry, but I have to share my bias first. I love babies. I like all of them. And I like the name of your group, the Black Mamas Matter Alliance, and I'm sure that probably extends to the Black Babies Matter Alliance too, so that's great. We know that women of color have about a 3 times more likelihood of having an abortion than not. And that's kind of I wanted to talk to you about that, because we're confronted with a situation where, in this case, Planned Parenthood is the #1 provider of that. And just historically, they have targeted that community, the women of color community, and they provide many more abortions there than elsewhere. And that's just wrong to me. And it's just, the data is so obvious. And why women of color? And why the target there? And it just seems unconscionable to me that people are making money off that, and somehow we tolerate it. And I just wanted to get your thoughts.
So I'm not a representative of Planned Parenthood, although I work with them extensively. So I'm speaking on behalf of Joya and not the organization. So how Black women interact with healthcare is a lot based upon the history of historical injustices and oppressions. And so perhaps instead of thinking it as they are being preyed upon by Planned Parenthood, that we are being provided a service because we don't have access to Medicaid expansion in some states. We don't have access to all the other services. We don't have hourly wage jobs that we can leave. So we don't have all the social things that people need to be able to make different choices around birth options.
The result of that is that losing babies.
Exactly. So the result of us not making choices in this building to support Black women means that Black women have to make a lot of different choices around their bodies. So if we decided that we believe that we should have access to paid leave, maybe that would impact who chooses to have an abortion or not. Like, there are choices that you all make here as policymakers that impact how we can live our lives that is much more impactful upon our lives than any one organization like Planned Parenthood. They are one small organization. You are the government. So how you decide to support women and how you decide to support Black women and listen to Black women really matters way more than what Planned Parenthood does.
Thank you, Madam Chair. If I might just follow up. And I hear what you're saying, and that makes sense. At the same time, I don't think that crosses their mind one little bit. I don't think they care. I think that their whole deal is looking at the bottom line, because that's when we get approached for funding and we get that kind of pressure. All right, I understand the point you're making, but I just trying to communicate a point. I don't think they care one bit.
So I'm going to give you a counterpoint. Our wonderful Congresswoman from Cleveland mentioned Cleveland Clinic. They choose not to open labor and delivery in the part of the city where they had their big hospital is because they don't make money there. They have a labor and delivery in the suburbs, right? So they have their hospital that's in the neighborhood that needs the most care for pregnant moms. They make a choice to say, we're not going to do any labor and delivery here. We're not going to provide services for the people in this community. So I would say that most organizations, big healthcare systems, make choices based upon money, and that's a choice that the United States has made in general around how we provide care. If we took that conversation outside of where you can make money, because I could go back and forth with you about all the systems and where they choose to put clinics, where they choose to put hospitals. Those are choices based upon money, based upon choices around Medicare and private insurance that are made here, that we can make very different choices.
Thank you, Madam Chair, and I'll close my comments with this. And thank you, Dr. Perry. I'll just say this. Let's agree on this. Okay. Maybe that's a two-prong approach, because I think you bring up some good points, and to the extent I and colleagues can be supportive of that, then I'm happy to try to do that. And at the same time, for those who I am convinced are preying on our community of color, I'm not supporting that. And so please know you're appreciated. Your work is appreciated, and hopefully we can work together on a two-prong approach to trying to make things better, okay?
Sounds great. Thank you.
Yield back. Thank you.
Thank you. Mr. Tucano of California.